Hello, dear friends. So, I'm Dr. Rahul Jain. I am a neurosurgeon. I am practicing in Gurgaon. I have my own hospital by the name of Jeevandhara Hospital in Gurgaon. Today, I want to discuss a very important topic, that is epilepsy. Epilepsy or seizures are abnormal body movements which happen to some individuals. They can be really affected by that. So, we need to understand what patients have epilepsy, how we can prevent the episodes of seizures, and what treatment modalities are available. So, to just start briefly, epilepsy is abnormal body movements which can happen anytime with or without any triggering situation. So, these usually are due to certain areas in the brain which have some abnormal discharges causing the seizures. So commonly seizures which we know are the seizures where the patient has frothing from mouth, he becomes unconscious, he falls down, he has abnormal limb movements. But then there are many other types of seizures. I come across lot of patients who suddenly become unconscious for 2-3 minutes and then they wake up again. This usually happens in younger age groups, in children. Sometimes we have a complaint from school that the child suddenly stops talk or interfere or talk with the friends, yeah, or he has a staring look in the class and then he becomes okay in next 2-3 minutes. So these are called a absent seizure. So there are many varieties of seizure. So most important, we need to identify whether the person having some abnormal movement or some abnormal features, whether it's a seizure, it's epilepsy or not. So if any of your family, friends, relatives have this kind of problem, you need to consult some neurologist and get evaluated. Second, there are one kind of epilepsy which starts from birth. So children come with seizures. They are usually due to some birth defects in the brain or due to some hypoxic brain damage occurring during delivery. So we need to understand that once a small child who is getting born has some problem during delivery, he is going to suffer from this epilepsy for throughout his life. So I urge every one of you that whosoever in your family is about to deliver or is pregnant, we should ensure that the delivery is always in a hospital or in a good institution, not at home or in some uh, hospitals which do not have proper facilities. Because if this child has a problem, then it is going to remain for the rest of his life. Then there are other causes of developing epilepsy later in life, like nutritional deficiency. So a deficiency of vitamin D, vitamin B12 leads to nerve damage causing epilepsy. Then there can be because of head injury. So if a brain gets injured, then the chances of developing seizure increase manifold. Then due to seizures, due to high blood sugar levels, blood pressure. So if any of this, since they are all preventable causes, we should try to prevent these things from happening. So if you are a diabetic, if you are a hypertensive, please try to control these, take proper treatment. Likewise, young people, when they drive, they are always a little careless, so they should be wearing helmets, they should follow proper rules and try not to get into an accident. Now, suppose if at all due to whatever reason patient develops seizure, so what is to be done? So one is the acute emergency state, like we are going in a mall, in market, and we see somebody just fall down and have abnormal movement. We should not crowd around the patient. We should make the patient lie down and put some soft thing below his head so that he doesn't get any head injury. So it can be a shopping bag, it can be something, whichever thing is available. If you don't have anything, so anybody who's wearing shoes, we can just take out his shoes and put it behind his head and make the patient in a sideways position. And then obviously get him to a hospital as soon as possible. Now the third thing comes that if patient is on treatment and still not getting control, so what are the options? So commonly we prescribe medicines for seizures, and almost 90% patients get relief by medicines. Mostly those who leave medicine in between, they tend to have problems and get recurrent seizures. But then if patient is not getting relief even after taking 2 3 epilepsy medicines together, then there is always option for surgery. There are so many surgical procedures available which are different for different patients, where we can correct the brain which is causing, see, part of the brain can be operated, or we do something called the deep brain stimulation, which can decrease seizure frequency significantly in patients who are not getting relief by medicines. And lastly, very important point I want to mention is the what we need to do to prevent, or if you are a patient of epilepsy, then what precautions you should be taking so that you have to take less medicine and you remain healthy and get less seizures. So first and foremost, diet. So anything which irritates the body can cause seizure. So we have to be careful that we do not take too many chilies, we do not take anything to which our body is allergic. So you have to find out what food suits you, what doesn't suit you. Second, taking alcohol, cigarette leads to nerve damage. So we have to avoid taking alcohol, cigarette like that. Thirdly, it is very important for all seizure patients to follow a disciplined lifestyle. So early to bed, early to rise. You should not sleep late. Secondly, use of mobiles, laptops, high lighting areas should be avoided because these cause seizures. Similarly, sounds which are very loud should be avoided. So patient with epilepsy should try not to wear earpods. You should not listen to songs with earpods on, or even if you are listening, don't keep the volume very high, because high sound also precipitates epilepsy. And last and very important is that we should take our meals on time. So people who do lot of fasting or do not take proper meal on time can land up with seizure if the blood glucose level falls down. So these are a few preventive steps which we need to take, and hopefully things will remain okay. And please continue your medicines, because medicines are the one which will keep you safe